All right, we're going to show you the small animal procedure for ozone and for UV light. This is for animals that are 30 pounds and under. The equipment that you're going to need, there's a couple pieces of equipment. One is a peristaltic pump. We have those and can make those available to you at a reasonable cost if you like. Many vets have those already. And the other is the GHL 1500, which we're going to be using, which is a small animal UV light machine that's out there. So the supplies that you're going to need to do this are, one is the cuvette. This is a special cuvette that allows UV light to go through. It has a special spiral in it that also helps the blood move and go through the tube and capture more light. You're going to need a pair of forceps or hemostat. However you access the vein for the animal, you're going to need a 30 cc syringe, another syringe possibly to draw up the blood. We'll talk about that in a second. And I'm not sure what you use for anticoagulant because we're only going to be dealing with 3 to 6 milliliters of blood, and we're going to be diluting that with saline, but if you need to, heparin and a smaller needle to be able to preload the syringe. All right, let's walk through the procedure now. Basically what we're going to do is we are going to fill this with the blood saline mix and put it in the pump and allow it to rotate through the light a total of 2 times, and that's going to give us the right amount of therapy. So that's why we designed this, so it's fairly easy, simple to do, and we get, again, the same amount of dose all the time. So our first procedure is I need to get some saline, and I am going to prime the tubing with saline. So the tubing itself actually holds 12 to 13 cc's of liquid. So I'm just going to drop about 15 cc's, a little bit more here, and put that needle off because now I need to hook this up, take the caps off of the cuvette, and I will hook then the syringe up to the cuvette, and I am going to now force all the air out of the cuvette and prime it with saline. So what I need to do is make sure that the turbulator is facing upward, so all the air bubbles are pushed out of it. We can't really have air bubbles in this. If you have air bubbles in, the IV pump will stop running and then you have to do a couple of things. So there we are. I'm totally primed. I don't have any air in it, and I'm just going to put a clamp on it. So now I can take this off. And for right now, I'm just going to attach these two together, and I can set that down then. All right. Now what I'm going to do is I am going to take this syringe again, and I'm going to draw up as close as I can to 12 or so cc's of saline, because I will be adding the blood to this. So if I go down to 10, 11, 12, all right. And again, I'm just going to cap this and take this off. Now, if the animal is there, and I can, and I put maybe a butterfly needle in, so I could take this and I could attach this to the butterfly needle and draw the 3 to 6 cc's of blood up into here. Now, we've just got a simulation, so we've got some simulation of blood here. I'm going to give myself a little bit of room in the syringe, and I'm going to take this blood into this here, which is the saline mix. So we have the correct amount of saline to blood. This is what we're going to pass by the light then. So what we're going to do now is we're going to take the cuvette that's already primed and full, and I am going to take this apart and hook up the syringe. Okay. I'm going to unclamp it. I had a clamp on that. And what I'm going to do now is I'm going to push the blood mix in, and that'll push out the saline. See, going through the turbo there. All right, now the whole cuvette, and unit is full. I want to make sure I do not have any air in the unit, so I need to reclamp that. If you get air in, your pump is going to tell you about it. And I'm going to unhook then my blood syringe and hook this up. Let's take a paper towel, make sure everything's clean. And now we can take the clamp off because I've tied the male to the female side, and we'll put this first off into the unit. I want to have the long side down toward the peristaltic pump. Make sure my unit is on and works. Yep. And I'm going to do that. Now as those bulbs are heating up, I'm just going to show you as far as setting the peristaltic pump. This unit has, let me explain, we have about 12 cc's of blood in here. I want that to pass through twice. So my total volume is going to be 24 cc's. So I'm going to go down to this, and I need to put my volume down to 24. Now my time up here, I want to be 4 minutes. 4 minutes is the right amount of time to pass that through, and that's I'm going to take that down then to 4 minutes. That also tells me that I'm going to do 360 cc's or milliliters of blood in an hour. That's our speed rate, which we've talked about before, is 6 milliliters per minute. So my unit is all set now, and I'm sure your unit, you can play around and figure out how to do your unit. I am going to put the line into my unit, make sure that it's all nice and tight. Get it in there, that's where it detects bubbles. And I'm going to close my unit. My light is on, my line is full, my timer is 24 milliliters we're going to pass through for 4 minutes. And we're going to press the start and
Station begin.
Start going. All right, we can turn, this machine is stopped. It says, and it made the sound and beeped, said that we had gone through 24 milliliters at that rate. So now I can take my tubing again out. And this is the treated UV blood. Now we want to add to that ozone. So I can set that down. This is my syringe for ozone. This is my ozone generator. This is the oxygen tank. I need to turn that up to 1/8. And on this machine here, I'll turn the machine on. Don't mind the numbers there, that's amperage. But what I'm going to do is hook that up and allow it to fill just for, maybe 15-20 seconds, because the oxygen has to get in and be treated, and we have a little bit of what we call purging, or just getting rid of the air that's in there to make sure that we've got about a 50 gamma. You can use 30 to 50, whatever you've been trained in. So I'm going to take that off, get rid of that ozone, and hook it up. And I don't need very much ozone, and that's all I need. And so I turned it off. Now I have about 7, 8. What you want to do is match the amount of blood to the amount of ozone that you have. So again, I'm going to put my clamp on the treated blood line, and I am going to open that up. Now what I want to do is I want to draw in, unclamp, and draw in the treated UV treated blood to mix with the ozone. All right, I'm good there. Let's take that off. Now this is all sealed. That can be disposed of. This is my ozone blood mix, and this should be mixed up for 20 to 30 seconds to make sure that the ozone has thoroughly combined in the blood. Actually, as soon as the ozone hits the blood, it combines and creates the ozonides, and you have your therapy. So right now what we've done is we have created a O3 UV therapy. I'm going to get rid of just some of the oxygen now that's in there because all the ozone is gone. I am going to hook up a needle, and this then will be ready to be either infused back into the vein or sub-Q, depending on how you want to do that. And that is the O3 UV therapy.